My name's Jessica. I used to work in the cath lab as a staff nurse, and I've been redeployed to the ITU.
So I'm Katie Francis, and previously I worked as a congenital heart disease registrar, cardiology registrar, and now I'm working on the intensive care unit as a registrar there.
So my name's Lloyd. I'm one of the cardiac anaesthetists at Barts Health Centre. I've been here for about 5 years, but I've been redeployed now to be an intensive care consultant with the level 6 intensive care team.
My normal role involves a lot of outpatient work and some ward work, so there's a lot more machines, a lot more sort of technical sides of things that we have to consider, and there's a lot more in-depth assessment of each patient and their hemodynamic.
I worried about not knowing things, not knowing when to escalate, what things I should be escalating, how do I know if my patient is deteriorating?
Probably the unknown. I think that's the scariest thing for everyone involved in this situation. But as I said before, relying on other team members that have sort of been there, relying on the physiotherapists, the senior nursing staff, it makes that unknown a little bit more comfortable. And we are all in this together, and we are finding our feet and figuring out what works and what doesn't, sometimes on an hourly to hourly basis. And getting through it together.
I've always felt very supported and able to ask questions, as well as being given some responsibility to get on with things up to my comfort level, and that's been great.
The nurses I've worked with upstairs were very supportive. They're always answering my questions without making me feel like I'm being stupid by asking them. And just going through things with me very, very patiently.
And there is a great sense of team spirit and camaraderie. There's a lot of people who are acquiring new skills, but also there's a great skill mix. There's also a lot of very experienced people on the unit. So there's always lots of people to ask about things if we're not sure. We've
got a fantastic team that we're working with, everyone from the junior medical staff to the security, to the wards people, to the nurses, all the way to the senior management. Everyone's been fantastic in banding together and getting our patients through this.
It doesn't seem as scary as I thought it was going to be, and it's quite nice learning new things.
Being part of the team that's facing this huge challenge of COVID-19 and the sense of satisfaction and pulling together all elements of healthcare professionals pulling together to try and make a difference to patients gives a great sense of satisfaction, and I hope that by doing it I can make a little bit of a personal difference, and certainly as part of a big team overall we can make a big difference, and that's why.
If you can do anything to help, if you can increase your skill set and your knowledge and give us a hand, it's a wonderful thing to be able to do.